Today's session is going to be X-raying optimal healthcare financing model for Nigeria. We don't need to tell ourselves that healthcare has been a big issue, one that demands and we've done very little to address it. Of course, the key solution resides in the funding model that is appropriate to get it resolved on a sustainable basis. In our midst today, we have an expert. We have somebody who has been in this area, who has supported organizations, investors, donors, to ensure that healthcare is properly funded and financed. But before I introduce him, we'll start talking about it. He will do exactly that. But before I proceed, I'm going to be welcoming my boss, or my bosses, because I have two bosses here. The GMD CEO of GTI Capital, to come and give us his opening remarks. Please, a round of put our hands together for him as he comes up. Thank you.
Business roundtable that we put together every month to, one, educate the community and in a bit to giving back. The interesting thing about today's subject is that we are all aware what from brain, some call it brain drain, some call it pocket drain, has done to Nigeria in the last, say, 2 decades. And we are all victims. We are all victims in one way or the other. Some people in their very kind manner describe most of our hospitals as consulting rooms or clinics at best. And you just continue to wonder why, how did you get to this point? If you look deep, what you find is that many of our professionals, they are all out. I had a personal experience some time ago. In fact, this was well over 10 years ago. Well over 10 years. Can you imagine? My son was ill or something, and so I had to see him. It wasn't even an admission. It was a casual visit to a clinic. And guess what happened? I recall, yes. The boy was there in the consulting room. So I came in and the doctor saw me. You know what he said? Rather than attending to my son, he said, "Oga, I needed to see you." A medical doctor. And I was like, yes. I even thought he was going to tell me something about my son. You know what he said? He said he needed help. That I should please get him a job. I should get him out of here. Do you know that day I was almost moved to tears? And it was not because of what he said, but first of all, I felt very guilty. First of all, I felt betrayed. There were a lot of things ran through my head. Wait a minute, what? Daylight. It was in the morning. It was about 9 a.m. I wouldn't have assumed that the guy was drunk. I felt very unsafe that my son's life was in the hands of a desperate person. So many things. I felt bad that this guy, the system has been unfair to him, or what? But the rest is history. But I was a victim at that level. Then if you take it to higher level, you will see different things. You will see, I'm sure all of us have been victims at one time or the other. We have had cases of people that died in Nigeria because of 5,000 naira. I'm sure. Somebody was telling me a story of a woman that passed in a general hospital in Ikeja. The woman was in labor. I don't know if my English is correct. And they rushed her to this hospital. A general hospital, government hospital. Guess what the offense was? That she was a card-carrying member of that hospital. In other words, she was not registered. Do you know the woman was watch. She was unattended to, and the report I got as the woman passed. Can you believe it? So we are all victims, one form, one way or another. I'm sure if you check, you will find that you have a cousin, an uncle, a brother, a sister who is out there, a Nigerian professional, being slaved out of Nigeria technically. And so it calls for concern. And that's part of what is driving today's subject. Don't forget, we are supposed to be solution providers. That's what we are, aren't we? Is that not correct? Yeah. So, as investment bankers, every day I tell people, the future of every country is in the hands of the investment bankers. It's not in the hands of the politicians. And that's why we're here. And I'm sure that the expert that's going to dwell on this subject is going to do so much justice, that so much so that at the end of today's session, I want to believe that some of us will go away with something in one form or the other. But before I drop the microphone, the onus is on all of us to ensure that we do our bit and to make Nigeria a better place. I welcome you and thank you very much.
Again, I've been introduced. My name is Enitan Sanusi. I've been in this healthcare space, let me say by accident. And when you are in a space that you actually really do not know that you are in that space, essentially you take it as just a mere vocation. More than 23 years ago, I established a health platform called GODI Health and Fitness Club. In actual fact, it was called GODI Leisure Club. But essentially, it's done on us that this is one of the most potent preventive health outfits that ever bet in Lagos. You need to be there to see what we are doing there. And from that, I migrated dig down into the healthcare space. And I was founded another outfit that is called Aqua Health and Social Care Funding SPV Limited, which essentially is looking at how to bridge that funding gap in the healthcare space. As the MD has rightly mentioned, the state of the healthcare is in a falling state. The disparity in service is so wide. From the mass market, where you have a whole lot of suboptimal performance, to the upper market, where you have something that is comparative, a service that is compared to anything you can have in the world, but it's quite pricey. And this is the state where we are right now. To the public sector, where most of the health facilities, are run down, you can hardly get any good service coming out from them. So we have a real crisis at our hand on our health care. And the challenge, as my good friend Philip said, is the challenge of returns, the challenge of market, the dysfunctional on our market, the lack of strong players in the market, a market that is dominated by public sector, that is in a terrible state, where provision of services are in a mess. That's where we find ourselves. That and everybody have personal regarding going to the clinics and losing loved ones through avoidable sickness. We all know that our life expectancy here, life expectancy for is quality life expectancy is just about 46 years. So anybody that is able to actually live heartily, in good mind and body, for 46 years should be thanking his God. The life expectancy for adults is 54. And when you compare with Europe, in the US, where life expectancy is averaging 84, in the US, in Europe, where it's averaging about 88, in Asia, South Korea, Japan, where it's averaging 90. You see that our life expectancy, healthy life expectancy at 46 is appalling. It is very important to know that this presentation is being made from perspective of funding, of an investment. I'd like to introduce essentially what we do. This presentation is for this audience only, and we are not soliciting for any equity investments. We are not soliciting for any investment as because we just want to rub mind with you on the platform that we to have funding, to have structured funding inside our healthcare system from the private sector perspective. Maximization of the value and returns to investors with positive socio-economic impact to society. We help to develop and structure and manage health and social care equity funds for direct investment and co-investment opportunities in the sector. Basically, what this says is actually that we are in the business of attracting, managing investable funds in the healthcare sector with special focus on SMEs and large enterprises. Can we go? And our business focus areas. We focus on medical services and because we have to have a large base. We see healthcare from the perspective from the total holistic perspective. You have to look at healthcare not only from the perspective of treatment, you have to also look at it from the perspective of prevention. You have to also look at it from the perspective of the environment, because essentially that what makes care the totality of the health and social care space. We look at general and specialty hospitals, primary health clinics, diagnosis centers, pharmacy stores. We look at the infrastructure that drives it, the training and the staffing, the devices, equipment, accessories, digital health, mobile health, that everybody's talking about e-health now. Facilities development, how you continue to continue to make the facilities, healthcare facilities work. We look at the healthy living space, which are the natural and wellness club, the natural and organic nutrition. Nutrition is very, very important in health. And that is what we should not look. It is actually absolutely very, very important. We look at the fortified foods and drinks. We look at affordable social housing. Housing is also an integral part of health. Affordable one, social housing. Then environmental health, we look at the hygiene and sanitation, the water supplies and waste management, and we look at the health insurance. Now, we look at the sectors as more of a consumer, part of the larger consumer market. And we all know that a large consumer market where you have the opportunities, where you have a large population, provides strong returns for investors. Nigeria, as a market, is very favorable and very promising demography that we have. With the population of 188 million, our urban population growing at 6.5% per annum, and our cities booming, large migration to the cities provides a tremendous opportunity. Nigeria is actually the largest consumer market in Africa, and there's so much demand, immense demand for medication, nutrition, technology, social housing, and environmental health. The market is good because the middle class is growing. The households that are able to afford, with disposable income, to afford health services, the income level is actually growing. Contrary to the common wisdom that the average per capita income in Nigeria is $2,000, but in actual fact, in research of the world, the population right now of those who are earning $7,500 is about 8 million households. It is predicted that by 2030, that will increase to about 35 million households who will be earning something like more than $7,500. That is a whole lot of money. And we also have that expenditure will continue to increase. Right now it's about $15 billion. We expect that by 2030 it will reach $60 billion. We also have a whole lot of schemes that have been put in place. You must have heard of the Basic Health and Care Provision Fund, which by the effort of the media, putting this in the public domain, we have commitment of the federal government to enhance the funding through a dedicated percentage taken from the consolidated fund, the revenue consolidated fund. So we have annually at least $240 million that will be coming into the system. 50% of it will be for health insurance, dedicated to health insurance. The rest will be for provision of equipment and building up the infrastructures. Right now, we have understood that in 2018, that at least about $180 million has been appropriated for the sector. So it's really, really a very interesting time for. There's a lot of money rolling in there. There's a lot of money coming from the government. The government has been put under tremendous pressure to increase budgetary allocation for health. The donors, the like of Bill and Melinda Gates Foundation, are very, very active in health and in the funding process. The development financial institutions like Agency Francais, they also have been very, very active. African Development Bank has been very, very active. So there's a lot of money that is coming in there. Most of those money are coming via the government. Coming via the government. Can we move on? Expansion, revenue margin, expansion of our existing facilities to make sure that they can deliver better outcomes in terms of profitability, in terms of quality health outcomes. So what we do, we put ourselves in a position to enhance the turnaround of our health facilities. We work with government to ensure that some of the facilities they have in place, we can put best practices into these institutions to deliver better outcomes, to have operational efficiency. That's part of the things that we do. We also work in the private sector domain, which is actually our main area of concentration. to build a portfolio of performing health facilities that will deliver that growth that we need, that will deliver that outcome that we need, that will deliver that services that we need in the health sector. We work with them to enhance their performance, to build them up. We attract debt, long-term debt and equity capital in SMEs and large companies. And basically, as I said, in the private sector, we have fragmented players, small players, family-owned businesses that are undercapitalized. And we are working seriously hard to ramp up their efficiency level, because that is the unsung part of what we do. Go into a clinic, working with them on their revenue profile, working with them on their clientele profile, working with them on the services they provide, working with them to make sure that they are able to provide these services to you for their customers, and ensuring that actually the business is sustainable. So we build up this profile. We also offer specific solutions to the network of investors that are interested in this space. These are what we call the dungeon of the world. Going there and micromanaging the players in that particular sector to improve their performance, to improve health outcomes. And what we do again, we expand the base of relationship managers, the database of the players in that sector. We have at our fingertips the operators that can partner with our clinics, with our hospitals of performance. We have developers, sponsors, fund managers that are able to provide these services to improve performance, to structure the necessary public-private partnership to enhance the performance of the health entities. So, what is the sustainable model? This is the heart of why we are here. Sustainable funding of healthcare sector. We have found that the banks cannot do it. The banks don't have expertise. They don't actually understand that market. They don't understand the business of the hospitals. Few of them do, but even those who are in the consumer space do not understand the dynamics in the healthcare sector. This is the domain for social impact investing, and where you need long patient capital, a long-term capital. The overdrafts, the equipment leasing, the loans will not do it. You have to be a capital that is accompanying a long-term capital. That is what that sector needs. So what we do, we invest in the equity and the quasi-equity capital of this company, of these SMEs.
The class, your status in the economy, or economic class, So I'm thinking about the general hospitals, so that people on the streets have access to good health care. We all know the way the general hospitals are being run. We know, just this morning I heard about a doctor earning 70,000 naira, per month. Like all the issues that we have. so that, we have quality doctors, we have good health infrastructure. You don't need to, I'm not even sure about, there are certain diseases that you have in this country, and the only way you can get cure is to get out of the country. Even our president had to be traveling out, for proper health care. Like, what can we do? How can we really solve this problem? Because the model, I'm seeing this model that you presented as only just helping even the rich in the society. How does it trickle down to the general hospitals? What kind of funding model do we need to put in place so that the healthcare is not only, the general hospitals are not only necessarily funded by the government? Can private people also be a part of that? It's a whole lot of issues. Like, how do we get the problem solved?
So, the whole idea I think we should try to generate is, how do we now get funds? And well, as she was saying, to make even the health services available first, and then affordable second. And then the other thing is that how do we enhance the quality? Because just as the GMD said, you came to a hospital and then the doctor is tapping you, please, I'm not even interested in seeing your son now, please. How do I get out of this industry entirely? So I know doctors who have actually dropped their kits and bags to go into photography, and they tell me they're faring better. This is a fact from general doctor here, a consultant.
I noted is poverty. We know that poverty kills more than even the health issues itself. Most of the sicknesses or the health issues we have are actually poverty related. I noted professionalism. I noted profilations, which is as a result of not getting the professionals. I've had cases of during childbirth, all these native nurses that were not properly trained. And I think also, and I mentioned drain, I wrote it down to brain drain, where the good hands are leaving the countries. I think there are issues we need to look at critically, look for how to address them and see that we can actually benefit. That's why I said, you already mentioned affordability. So many people cannot afford their health, but I think it's as a result of poverty. If we are all fully engaged, we have a good economic sector where there are economic activities and we can afford these things. I think even when the investors come in, they can get a better return, a good working environment where there's a good policy. I think so we need to help us look at this, and if there's anyone that is here can help us take the message back to the appropriate quarters for proper address. Thank you very much.
So one thing that jumps at me is the fact that we're still looking at raising offshore funding for local health in country. The fact remains that over and over again, we need to think about the fact that this funding is offshore funds, and so there's a possibility of being exposed to foreign exchange rate risk. And if we're exposed to foreign exchange rate risk, it's just going to be the people investing in it, cleaning out after 5 years and moving on. And then the cost of that goes on and on and on to the common man. So my 2 cents is really thinking about structures where we can raise funds in country. So because it's health, there are loads of people that are interested. You can actually have a wrap over whatever it is you're doing, and you can raise funds below the sovereign, or at least at par with the sovereign. That way it's beneficial, it's long-term, it can help the common man, and this issue of cost is eventually addressed. And you don't necessarily pass on foreign exchange rate risk to the common man in the village, who is going to have to be a beneficiary of whatever health solution that you're proffering. So that's just my own 2 cents. Thank you.
On the private sector, like I said, we have the intermediation from AFDD, the interventions from IFC that once enhance private sector participation in the health sector areas. We are putting our attention basically on a particular geographic zone, which is Europe, and that is actually what we are doing, and we are working with small enterprises. I won't want to mention names. They are still ongoing in these areas, So we are essentially the private market focused. But having said that, we also have a practice that is also looking at the enhancing performance and undertaking reform in the public sector, to ensure that our public facilities are performing optimally through a reform process. And we have not had mandate in that area, but that is an area that is really very, very interesting for us. That's an area that we are wrapping up our competence in that area, aggregating enough partners to be able to offer that services, in the government area. But we essentially know what to do. We have partners who have had experience in that area, who have had experience in reform of the National Health Service Fund, National Health Scheme in England. We have partners who are working with us in that area that we can readily come in to do those type of to handle those type of mandates. Thank you very much.
Thank you for keeping faith. I must tell you that what upsets me is that we had a professor in front of us and we did not interrogate him sufficiently. And that's our loss. His foray into the way the NHS trusts work in England, the place of community action to providing complete health care, the way you structure financing to meet the challenges that you have, in my view, been impeccable without any flash. He's also told us very clearly that although he is a banker, he's not a ledger banker. He has capacity to bring imagination into the process of capital formation. Thank you very much. It is clear to all that based on what I saw some alpha returns on his investment portfolios. It is still remarkably quite small in size and therefore cannot make sufficient impact. But again, it's a private sector investor. He's not about to take a risk he cannot manage. He won't take a risk he cannot manage. He's contained his risk and he sustained the process. And if you want to upscale the process, it's entirely up to the community to decide what to do. So I must tell you, Mr. Enitan, what you've seen, what I've seen today gives me faith. It means that the kind of cerebral activity that is needed to change the process is still here. What I must tell you is that every time you have a conference like this, or a lecture like this, please do some reading. Otherwise, you will not be equipped to understand what the person is saying. You can't engage with him properly. You don't know what it is that is gain or loss. You're just looking. You can't afford to do that. You need to actually look at your market models and see how they work. Questions are okay, but really they didn't have any direct impact to us. I hope we can bring him back again. Maslow's hierarchy of needs. Healthcare is very important. We have not done enough for him. And please go back, look at the models again, and come back with your questions. Thank you all very much.